people hear the word diet, exercise when they go to their doctor, and immediately they're sort of turned off. Because it's like, if it were that easy, I would already do it. I don't need you to tell me to lose weight. I don't need you to tell me to exercise. I know I need to, but I can't. And so what we wanted to try and do is give people the opportunity to find ways to meaningfully engage in nutrition, in exercise, without it being this big stigma. Obesity is going up, sedentary lifestyle is going up, work from home. We've seen more people not active in the last 2 years because of a pandemic. So we are seeing people doing less, eating more, and being more unhealthy.
And that is a reflection of the priorities of our healthcare system broadly, in that we're a reactionary system. We treat disease. We grew up in, as medical students, learning about disease and treating disease. That's how our system is designed. I want people to understand that you can come to see a doctor well before a disease has developed, particularly as it relates to the cardiovascular system. So we started the Rush Center for Prevention of Cardiovascular Disease in 2021. And the whole purpose of this clinic is to find patients that have risks for cardiovascular disease. That's high blood pressure, high cholesterol, diabetes, and also have other sedentary behavior or musculoskeletal comorbidities. So then there's some reason why they're not moving around. And so that is a clear union of our two fields of physiatry and cardiology. And the purpose is to get these patients into our clinic, really aggressively manage their risk factors with lifestyle changes, so diet, exercise, and also medical therapy when appropriate. And I think when a patient walks into the prevention clinic, we see them holistically. We see them as a person with a story, with their own interests and their own cultural influences, and we take them in as they are and try to give them a really individualized treatment plan for prevention.
We've had a lot of people just come in saying they feel better, even if the numbers don't totally show to them that they're like, wow, I'm down 30 pounds, but they just feel better. And I think to me, that's the greatest success we have, because if you have someone feeling better, well, then they realize that these activities make a difference.
It's a unique clinic in that you have two different doctors from completely different disciplines actively collaborating together when you come into the visit. So patient walks in, I typically see the patient first and do a comprehensive prevention screening. I come out the room and I discuss with Max what my impression was, what I saw, what I think maybe he can focus in on, what were some of the gaps, and we kind of collaborate on what the plan will be. He'll go in then next right after me. He'll evaluate the patient with his lens, and then again, we collaborate again afterwards. Our whole mantra is making cardiovascular prevention personal, and understanding that every patient that walks into the clinic has a unique set of risk factors and set of preferences, and we can incorporate that into a tailored treatment program.
We will also screen you at that appointment for your mental health, how it's just to get a baseline, any comprehensive musculoskeletal exam to see if there's any neuromuscular issues that are preventing you from being active. We're trying to get markers that we can show objectively to you that you're making gains and making progress. Because one of the hardest parts about lifestyle medicine is that we're trying to prevent disease. We are successful if you don't have problems.
We have a provider network that we directly and closely collaborate with. We work with Dr. Ben Veenstra, a bariatric surgery. We have a behavioral psychologist and a dietitian that we're in close contact with that we refer patients out to. We send a lot of patients to the sleep clinic, so we work directly with sleep medicine in screening and treating sleep apnea. And have endocrinology colleagues that we're closely collaborating with as well.
So if you are a patient in the Rush system and have a primary care provider here, you can just simply ask your primary care provider to put a referral to us, and there's a whole scheduling pathway that will help the patients get scheduled into our clinic. You can walk into our office and make an appointment, and the front desk can help you. You don't have to be referred in.
Cardiovascular disease is a leading cause of death, and a lot of what contributes to cardiovascular disease is preventable and modifiable. So we can definitely stamp this disease out and limit the development of cardiovascular disease before it happens.